Welcome back. This is Dr. Cash, Dr. Cash Medical and Life. Well, today is actually, I'm wrapping up the week for telemedicine for follow-up on hospitalized patient. And I'd like to share with you just one patient who I thought it was important in terms of just education-wise for why it is important to do these kind of follow-up in a timely manner. The patient was just discharged, or matter of fact, patient left against medical advice just 2 days ago. Certainly, we were concerned about his own safety, his own health, and so that's why we do these kind of follow-up. And of course, today we visited a whole bunch of patients, but in his situation is quite unique, and I'd like to share. So, just briefly. For his privacy, of course, I won't mention his name or anything like that, but briefly, he's 72 years old. He was in the hospital for a few days. Initially, he presented to the hospital with nausea, vomiting, right upper quadrant sort of pain on the right side here. And subsequent imaging studies, we did CT scan, ultrasound, lab tests, and all of those tests confirmed that he has what we call choledocholithiasis, which means having gallstones or having stones in the common bile duct, which is the main duct that connects the gallbladder and the liver, and drained and connecting through, going through the pancreas and going into the small intestine, that first part of the small intestine. So it's basically having stones in that big drainage pipe that normally would drain a waste product from the liver and or the gallbladder, and also subsequently the pancreatic duct, or that drainage tube from the pancreas, also connect with it, and everything then drain into that small intestine. And so what happened was certainly he had the pain as a result of having stones in there, and sometimes by having stones in that tube, other than causing pain, you have poor flow or no flow, then you have buildup of debris and such, which can over time cause what we call stasis, or collection of fluid in there that can back up into the liver, and again can cause a problem and or back up into the pancreas that can cause pancreatitis or liver inflammation, hepatitis there, which again can also result in infection. Anytime that you have pooling of substance that should be moving and being excreted, then you can have a stasis, and you can have infection that can occur. So for him, let's take a look at his anatomy, or an example of the anatomy of what I'm talking about with the common bile duct, which is the drainage system, the main conduit from that is draining from the liver, the gallbladder, and the pancreas, to have a good understanding of what I'm talking about having stones in this. Let's look at the illustration. Here is an illustration of the biliary system, of which on the top is the liver, that brown organ there. Under it sits the gallbladder, the green sac with multiple stones, and then it drains out through the cystic duct into the common bile duct, which a lot of stone tends to come out and pool there, and that's what's happening in our patient. From there, it will then try to move down through the head of the pancreas, that long elongated tan organ there. A lot of times stones comes out, they get stuck, as there are many kinks in around as they maneuver through the head of the pancreas. Creates a lot of problems. So one have to do the ERCP, or that procedure, to remove the stone and or to put a stent in for drainage. Now that we have somewhat of an understanding of the anatomy of what it looks like, what we ended up doing for this patient was having multiple consultants to see the patients, including a general surgeon, as well as the GI specialist gastroenterologist. After reviewing all the imaging studies, the MRCP and ultrasound and CT scan, the GI doctor or the gastroenterologist decided to certainly recommend a procedure called ERCP, which basically involves putting a camera down through the throat into the esophagus, into the stomach, and then traversing past the stomach into that first portion of the small intestine where the common bile duct exit into the small intestine, and from there the specialists then make a little nick, what we call sphincterectomy, and then put even a smaller device through that tube up into the common bile duct and take some pictures, and then if they can, they'll scoop out the stones or whatever stone there's there. If they can't, they may not be able to do it. And in this case, unfortunately, the GI specialist was not able to remove the stones, but instead, in addition to performing a sphincterectomy, basically making that opening a little bit bigger, he also inserted a stent into that duct to open things up, so to relieve the pressure and to allow biles to drain and the waste product for the pancreas as well as the liver to drain down, as to avoid complications such as infection of that nature, and will then be taken care of down the road, further down the road. And the stent will then need to be, of course, be removed, and will attempt again to remove the stones as well. Now, further recommendation was made for the patient to go ahead and have surgery to remove the gallbladder in a procedure which we call laparoscopic cholecystectomy, essentially using devices and make a couple of holes in the abdominal wall into the gallbladder to gain access to and then remove the gallbladder. However, in this situation, the patient refused, even though the family wanted for the patient to go ahead and have the surgery, but the patient refused. And so he decided that he just want to go home. He didn't want any surgery, any cut, anything like that. So he signed himself against medical advice, and so he left and he went home again just 2 days ago. And today I did a recall back, of which I called and spoke with the daughter and as well as the patient. And certainly the patient is not doing well. He's not feeling well. He feels crummies. He can't poop. He can't pee. And he feels horrible. And so we went ahead and certainly recommend for him to go ahead and go get some lab tests done at the very least, even though he hates hospital. He doesn't want to do anything with hospital, but he's feeling crummy, feeling sick. So he was ordered to have some lab tests done. So he went and he had some lab tests done, which now he's in complete renal failure, which could mean a couple of different things. He's either very sick and septic and in renal failure from there, or having some other primary problems with the kidneys from all the dye studies that were done earlier, or he could just be totally dehydrated and not be able to eat or drink because he's been sick. And so I just hung up the phone just now and asked the daughter to take him back into the hospital. Certainly he probably doesn't want to go, but this is quite dangerous, and if he doesn't go back in, he will likely just get sicker and potentially his life may be on the line. So I hope that he would be willing to go. And tomorrow we'll check in with him to see how he's doing. Subsequently, certainly the kidneys need to be checked, and the gallbladder probably will need to be removed sooner than later if he's septic. And hopefully he will do well. I'll keep you guys posted on this gentleman. But again, having stones in the common bile duct blocking, causing issues, can lead to many other things in addition to just having pain and having inflammation of the liver. You can become septic, have pancreatitis, having a whole bunch of other things that can go wrong. So I wish this guy the best of luck, and I will check with him either later tonight or tomorrow to see how he's doing, and I'll keep you guys posted. Well, thank you for joining us. I hope that you learned something, and if you enjoy this kind of materials, I would really appreciate if you can join our channel and subscribe to us, give us a thumbs up, and I'll see you guys next time. Have a good one. Bye.